brings us very nicely onto some figures, because I'd like us to talk about some figures. But before we do, I'm going to put a big proviso in here and say that for each individual, this is something that you must discuss with your own individual healthcare provider. So the figures that we talk about here are going to be general figures, general ballpark figures. Please do not take this as your individual level that you should be aiming for, because as Grace has just said, it may not be appropriate for you within your life, within your circumstances, within different things that you're doing. So let's talk about some figures. So, Grace, you talked about the fasting and glucose levels. And ideally, if you're doing a reading first thing in the morning, fasting being not having anything to eat or drink for at least 8 hours, what sort of figures would we be looking to aim for? And what sort of figures might be a bit too high or a bit too low?
So we should really aim for blood glucose levels of between 4 and 7 fasting, in general terms. And I think by doing that, we then know that our patients are less likely to have, to get the complications of diabetes, providing they stay within those levels. We know that even though they have good levels, they can still get the complications. So just to set that record straight. And then, Diabetes UK very clearly points out, and I believe NICE as well, that, 2 hours after food, then we should be looking for a blood glucose level of 8 or 8.5.
Or less.
Or less, yeah.
Yeah. But sorry, Grace, and just to highlight that never going below 4.
Yes. Never going below 4, because that person will be at risk of hypoglycemia. Again, another tip I was taught growing up as a diabetes specialist nurse is that 4 is the floor. So we don't want our patients to go down below 4. And then for those people who are drivers, you need to be 5 and above to drive. So some key tips that I teach my practice nurses or even GPs or whoever I'm teaching, these are the key messages I give in terms of blood glucose levels, depending on the individual person you're speaking with.
4 is the floor. 4 is the floor, and 5 to drive. Yeah, I've learned that one as well. So now, again, I'm going to reiterate it, just because I don't want anybody to be aiming for something that's unrealistic for them and is unsafe for them. If somebody is elderly, if somebody is frail, if somebody is in different circumstances, we're not trying to get their blood glucose levels somewhere between 4 and 7, because that's not going to be safe, clinically safe for that person. So please, 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 you must address this. You must discuss this with your healthcare professional. You are empowered through the use of the self-glucose monitoring to know what your levels are. But on the other side of that, discussing it with your healthcare professional will give you the information to know what your target levels are. We call them target levels. You could call them goals, however we want to term them. You have to discuss this with your healthcare professional. So, Gideon, would you like to say something in terms of the continuous glucose monitoring? What sort of levels, and maybe something about the frequency that we would expect that people would be monitoring as well?
That's a very good question in terms of moving from self-monitoring blood glucose, and then with advance in technology, we're able to offer our patients better facilities, that is the continuous glucose monitoring. So we have got continuous glucose monitoring as intermittent. So the one we use is the one which is more popular now, most recently, which has come most recently, is flash glucose monitoring or Freestyle Libra. So with that, we use is intermittent scanning. You get a sensor, which is attached subcutaneously under the skin, and with that, if you've got a smartphone, that information will be relayed to the smartphone or a scanner, which you'll be provided with Freestyle Libra. But that will depend upon how how many times the patient scans, and it gives you the readings. So we still want to aim to be within the target range. But the good thing about the so-called flash glucose monitoring, it gives you the trend. It will show you whether your sugar level is going up or is going down. And with the freestyle Libra tool, which we are using in most patients, it has got an alarm. If you are going to get a very high sugar level, or low sugar levels, there is alarm which wakes you up, especially for hypoglycemia. So this gives a peace of mind for our patients. If you look at most patients who are either type 1 or type 2, they are on multiple injections. They are always anxious and they're worried about hypoglycemia. So by using the so-called continuous glucose monitoring, which is one of them is flash glucose monitoring, is intermittent. It depends upon how many times you scans. The fear of hypoglycemia is taken out of the equation. But also the advantage of the flash glucose monitoring, it gives you retrospectively 8 hours worth of data, that the glucose levels 8 hours ago. What happened 8 hours ago, it stores in it. It will give you the trend whether they're going to go up or down. And if you're going to have hypoglycemia, there will be an alarm. And this has increased the quality of life to our patients. I think for patients I've seen, we've got in my center, I've got about just over 300 patients on flash glucose monitoring. At least if you get the satisfaction for patients, peace of mind, most of them are saying that since they have the flash glucose monitoring, it has transformed their lives. That's very important. But also, so the flash glucose monitoring, it is intermittent. It depends upon when the patient will scan and it will show the readings. But also with nice guidelines, and we have got a more advanced glucose monitoring, which is continuous in form of Dexcom. So it gives you real-time glucose monitoring. Is continuous. As long as the patient wears the sensor, it will be giving the readings. It's continuous, and then you change the sensor every 10 days, but you have to keep, you change the sensor every 10 days, but you have to keep the communication part of the sensor for 3 months. This gives you real-time reading, and you will know what happened at any time. So with flash glucose monitoring, it's intermittent. Yes, you use the sensor for 2 weeks. You have to change every 2 weeks. It costs about maybe 57 pounds, but it's worth it for most of our patients. The real-time continuous glucose monitoring in form of Dexcom, for instance, is all the time. And with that, you'll be able to look at whether the patient is in target or below target, when are they getting hypoglycemia, and it has transformed patient care overall. So based on my experience, I've got a few patients, at least 300 patients on flash glucose monitoring. We are getting better satisfaction with them. And some of them, when they come with the result, they've got better diabetes control. So it helps with, in terms of reduction in time spent in hypoglycemia, most of the patients. It has improved the quality of life for our patients. And we are using now for different patients. We know the indication is for type 1 with poorly controlled diabetes, but also having recurrent hypoglycemia. But with update in guidelines, we are using for type 2 diabetes who are on multiple injections. By multiple injection, it means 2 injections or more. So the indication, the target group, the group of patients who are benefiting from technology has increased. And I think both real-time CGM in form of Dexcom or intermittent glucose monitoring in form of flash glucose monitoring has transformed patient care, and I can say that it's a game changer. And the hope is that this will reduce both acute complications and long-term complications.
Yeah, thank you very much for that, Gideon. Oh, sorry, Grace, you wanted to.
Yes, I was just going to add, exactly, what Gideon says is right. But we do have an aging population, and we do have aging people with type 1 diabetes now in nursing homes. And one of our decisions as an organization was that we would support the nursing home patients with type 1 diabetes and also MDI in type 2 diabetes, because we can also prevent hospital admissions by picking up, early hypoglycemia or risk of hypoglycemia, using the alarms, and also being able to treat those patients before they actually become symptomatic, which stops people being admitted to hospital. And we know in nursing homes, the staff are not diabetes experts, and they call the ambulance, out for reasons sometimes that, they're not sure what to do, and it's probably the right thing for them to do that at that time. But for those patients who are constantly in and out of hospital with hypoglycemia, hyperglycemia, DKA, for our aging population and some of our patients with learning disabilities and mental health, these technology will help us to support them and keep them safe in the community. The other point I wanted to make was about the fact that with flash glucose monitoring, where most of my experience is that you can also use the Freestyle Libre link, which alerts a relative, which alerts someone, the person could be in university and the mum's at home and she gets an alert to say the blood sugar's going high or low. They can support the person with diabetes from afar by giving them the advice, you need to do something about your blood sugars, they're going low now. So it's all very exciting times, I think, in terms of diabetes and monitoring. And going forward, I think, it's less stressful. You can just imagine a mother with a child with diabetes, and they're sleeping and their blood sugar's going low, and, they are able now to be informed so that they can actually, treat that low blood glucose level and prevent a hospital admission.